Good afternoon, everyone. Thank you for joining us today. Today, we are joined by our friend and colleague, Shelly Gladden with the Oklahoma Able Tech. She is going to be sharing resources and programs they have available. If you have any questions, we are a small group. Please feel free to unmute your line or put a question in the chat. If you're watching this recording, please do not hesitate to reach out if you have any questions or would like for me to help make connection or contact information or get you connected. With that said, Shelly, I will turn it over to you.
Awesome. Thank you. Thanks for having me today. My name is Shelly Gladden, and I'm going to be talking to you today about AbleTech's programs and services. I don't know how familiar any of you are with this program, so hopefully you will all learn something new. Oklahoma AbleTech's mission is to improve the lives of all Oklahomans by providing assistive technology known as AT, devices and services, financing opportunities, digital accessibility services, advocacy, and education. Our mission is making life accessible to Oklahomans of all ages and abilities. So we cover the entire lifespan, and we cover all disabling conditions through our services that we provide. So I'm going to spend some time talking to you about what it is that we're talking about, what is assistive technology and services, and then how Oklahoma Able Tech, as well as other programs in other states, provide those services. So to begin with, what is this word assistive technology, or AT, that you see or hear people talking about? And really, it's not really a trick question. AT is anything that can help a person with a disability do a task easier, better, faster, or more efficiently that might otherwise be difficult or impossible to do without it. Pretty broad definition. Typically, we think of items that you purchase off the shelf for assistive technology, like hearing aids or low vision equipment, or a fancy, high dollar speech communication device. But it can really be anything that you purchase off the shelf for any other purpose, as long as you're using it to help you do that task easier, better, faster, more efficiently, then it becomes assistive technology. It can be low tech to mid tech to high tech devices. One example that I like to give is my smartwatch that I have. All of it, a lot of us have that. A lot of us have that smartwatch, that Apple Watch, or whatever brand it might be, that is helping us be more efficient, receive those text messages, receive those emails and notifications, and monitor our exercising. But me, for example, with someone with hearing loss who has hearing aids, now my smartwatch has become assistive technology because it is helping me receive those things that I can't hear or know when my phone's ringing, things like that. So I encourage people to think outside of the box when you're thinking about what is assistive technology. Again, it can be anything as long as you're using it for the purpose of helping someone with a disability do something that they normally would not be able to do. Assistive technology also covers those services. And so it's those services that directly assist an individual with a disability with the selection, acquisition, or use of an AT device. So those would be those individuals that are training or helping in making the informed decision of the right type of assistive technology that they might need. Assistive technology really is broken down in these main categories that you see on the screen, which I'll read them, is computer access, daily living, environmental adaptations, hearing, learning, cognition, and development are kind of bulked together in the AT categories. Recreation, seating, positioning, and mobility, speech communication, vehicle modification, and vision. So I wanted to give you a few examples of what those look like in regards to tangible types of assistive technology that we're talking about. So in regards to daily living, it could be some modified silverware or modified eating plates and cups. It could be a modified dressing aid. It could be a modified medication reminder. Looking at environmental adaptations, it might be as simple as a modified remote control. I don't know about you, but even myself and my mom have a difficult time with the remote controls. So let's look at maybe doing that a little bit simpler, an easier version of that. Echo Show smart home technology has become infused into the assistive technology world of being able to help control your environment, being able to unlock the door, turn on the lights, start the coffee pot, turn on the radio, give me my daily reminder of to-dos that we're going to do. It's a great way. I love that smart home technology has been infused into the assistive technology world. These are just a couple of hearing assistive technology examples. It might be a modified alert device or a device that helps you be notified of a smoke alarm. So if you can't hear your notifications or hear what's going on in your environment, you want to think about other ways that you can receive that notification. So that's going to be tactily or visually, right? So the Dream Zone cell phone signaler is a visual alert to let you know that you are receiving notifications on your phone. The LifeTone alarm clock is a clock that syncs with the smoke alarm that allows people to be notified tactily. So there's a bed shaker that's connected to it. So you're notified of those environmental alerts that you need to be alerted on. These are a couple of more examples in the learning, cognition, and development. Maybe it's a visual organizer like the kitchen cooking life skills folders. I mean, that is very, very low technology, something that is made with items that we already have to help someone who might need that prompt, that visual prompt, that stepping out prompt to complete the task that they are trying to complete. Computer access, just a couple of examples here. Maybe it's a stylus if you're not able to access the screen tactily. Maybe it is a modified keyboard that has different colors and letterings to it to help someone who's visually impaired. And then recreation, sports, and leisure. I love these, being able to help someone continue to do activities that they enjoy, who might not be able to do it otherwise. This is a modified fishing pole holder, and then a switch adapted toy for a child that might not be able to physically play with the toy independently. A couple of different speech communication devices, whether it's a communication board or tangible object cards to help someone communicate their wants and needs. Here at AbleTech, what is important to think about when you are helping individuals consider the right assistive technology, these are kind of the spot-on things that we consider and look at when we're helping individuals that we serve. The first thing you want to consider is the individual's preference should always take the front seat of the assistive technology that you are considering. Looking at their age, looking at their adaptability to the assistive technology, and what kind of preferences they're looking for to accommodate their needs. Focusing on the practical use of the assistive technology is very important. I mentioned hearing and smoke alarm alert device earlier. If you're able to hear the smoke alarms, that might not be practical for you. If you have difficulty hearing other things in your house, like the oven timer or the doorbell, then we want to focus on some different types of assistive technology for you. And then kind of transitions to selection is based upon the individual's needs. Consider technology the individual is already using. I feel like that is encompassed in that beginning definition of assistive technology. If you have a smartwatch, that is going to help you do, if you already have a smartwatch, then let's consider using that for a way to help you get the assistive technology that you need. And then the device needs to be familiar before an individual might accept or decline the use prior to acquiring it. So those concepts are really the backbone to what AbleTech does to help us serve the clients that we serve across the state. This is a screen of the different types of services that AbleTech offers. I should mention here that AbleTech is funded through the Administration for Community Living of the U.S. Department of Health and Human Services. It is funded through the Assistive Technology Act, originated in 1998. It was just recently authorized as the 21st Century AT Act program. And so we are mandated to do these core activities as an AT Act program. By the way, every state and U.S. territory has an Assistive Technology Act program, just like AbleTech. We are charged with doing device demonstrations, device short-term loans, device reutilization, financial loans, and digital accessibility. These 5 core programs help individuals get the access to and acquisition of the devices that they need, not only to make an informed decision, trial the device, and then get access to it. So now I'll take a few minutes to kind of go through, dive a little bit deeper into each of those programs and what it looks like in Oklahoma and how we do that. So people call us regularly or refer to us regularly to say, I have a disabling condition. I have a disability that's preventing me from doing blank. And I need some information on assistive technology devices that can help me do that independently, better, more efficiently. The first place we're going to start is with a device demonstration. We are going to provide an opportunity to compare and contrast different features, different products, give the individual the chance to see, touch, and play with the technology in order to help them make a more informed decision on if that piece of technology is going to be beneficial to them or not. Hands-on exploration of the devices, information on the latest technology, low-tech solution and adaptations if that's needed, and then also provide those referral sources if they are looking for the vendor, looking for pricing, looking for funding options to be able to then go and acquire that technology. I feel like I need to also say that we do not sell any products. We are there just as information and resource for individuals to find the right solutions that they need. So we've brought someone in for a demonstration. What do we do next? So it's one thing to explore with some technology and different AT devices in our office or in a select setting, but how do you know that is really going to help you meet your needs once you leave the office and you're in your intended environment, whether it's work, school, community living, at home, on the playground, wherever that, at church, whatever that might be. So we provide device short-term loans to a short-term loan so the individuals can have this equipment in that preferred environment. It's called a short-term loan, and it is completely at no cost to Oklahomans. It can be a short-term loan to, again, assist with that decision-making. It could be a short-term loan for someone who has their device in for repair, or maybe they're waiting on funding. There are a lot of individuals that just need that accommodation for a short-term basis. Maybe it's a temporary disability. Last weekend, we loaned a battery-operated scooter to a cheer coach who was in the OSU parade. She had a torn knee and was not able to walk in the parade. So we were able to provide a short-term accommodation for her by letting her borrow one of those scooters for the day so she could then still continue in the homecoming parade. We also have a lot of professionals that borrow from our inventory for professional development or training, or maybe they are doing a staff in service and they want to learn more about the new speech communication devices that have come out, or as an example, situations like that. Anyone can borrow from Oklahoma Able Tech. We loan items out for a 6-week time period on average. And then typically we hold it to 3 devices at one time. And we ship things out by UPS at no cost. We ask individuals that are borrowing equipment to hang on to that box and all of that equipment. There's a return shipping label that's in the box that then they just put it back on there and send it back out to us. Some of the data that we collect on that is going to be the ability to make an informed decision on the assistive technology, the satisfaction of the assistive technology that they're using, and their purpose for using the program. Some individuals, this is the only way that the technology is available to them for a short-term loan. Some individuals might have other resources, but they don't have the time or maybe even the patience to go through the process to do that. So those are data points that we collect that then we submit to the Administration for Community Living on an annual basis. So then that is helping Oklahomans make informed decisions about what type of technology they might need, what's going to be important to them. Then we have a couple of programs that help Oklahomans acquire that technology and services that they're looking for. The first one is where I'm at today, the Able Tech Device Reutilization Program. It's housed in Oklahoma City, but it services the entire state like the rest of the Able Tech program. My home office actually is on Stillwater campus, by the way. So the purpose of the device reutilization program is to allow individuals to acquire items through what we call reuse and exchange activities. Reuse activities are items that we take in, gently used, donated durable medical equipment from Oklahoma residents. These items are retrieved, received, refurbished, repaired, sanitized, and then reassigned to match other individuals across the state that need it. It's considered a long-term loan. We ask individuals to return it to the program when they're no longer using it. We do this particular program in partnership with Oklahoma Healthcare Authority. Okay, yeah, I thought I had more information on the next slide. With Oklahoma Healthcare Authority, and I'll talk about that relationship here in a minute. We also have what we call an exchange program, and that is where basically a person-to-person exchange, which functions like a classified online marketplace offering gently used assistive technology and durable medical equipment. We end up posting a lot of things on this exchange list as we have about 5,000 assistive technology devices in our short-term loan lending library. As items are aging out, maybe being discontinued or newer versions are coming out, we want to have available in our short-term loan program items that are current and relevant. So when those items age out, we'll list items on this exchange site for individuals to take at no cost. It does have the capability for individuals to list items that they want to either give away or sell, or, make an offer type of situation. And so that is a service that we provide Oklahomans. It is housed on our website. It is user login and password protected. Those two kind of combined together. I want to talk to you a little bit about the Oklahoma Healthcare Authority relationship that we have. So Oklahoma Healthcare Authority admin rules say that if Medicaid pays for a piece of durable medical equipment, Medicaid maintains ownership of that equipment, right? So even if the individual is only using it for a temporary time, if they are no longer using it and it's no longer medically necessary, Oklahoma Healthcare Authority has maintained ownership of that, and we are the agency that works collaboratively with the agency to go in and retrieve that durable medical equipment and then go through the process of repair, refurbish, sanitize, and get it back out to another individual that needs it. Because of this relationship, we do give Sooner Care members first priority of any equipment that we have available in our inventory. And then after we've had a piece of equipment in our inventory for 30 days, on day 31 is open up to any Oklahoman that needs it at no cost. These are some examples of some of those items that we have in collaboration with Oklahoma Healthcare Authority. That is pieces of durable medical equipment such as braces, bath and shower benches, bathroom devices. That's going to be things like grab bars, raised toilet seats. Then we have blood pressure monitors, canes, commodes, CPAP and BiPAP machines, gait trainers, hospital beds, positioning devices, wheelchairs, walkers, vision equipment, all of those good things. As I mentioned before, Sooner Care members do receive priority. We do include pediatric and bariatric equipment. And then because we do this in collaboration with Oklahoma Medicaid, some of this equipment does require that standard documentation, whether it's a doctor's order, an evaluation, a sleep study exam, things like that. But we work with the individuals and the applicants as they come in on helping them understand and determine what those requirements are. We also do a lot of due diligence to try to make sure that the equipment is the appropriate match. We don't want individuals to be in a wheelchair that's not the right size, which happens many times when you see medical equipment for sale at a garage sale or at Goodwill, things like that. So we want to try to encourage individuals to use this program so we can help ensure that it is matched appropriately. The next program that I want to talk to you about is the AbleTech Financial Loan Program. The purpose of the financial loan program is to provide banking options for individuals to purchase the needed assistive technology or medical equipment that they might not otherwise have access to. This program is kind of near and dear to me. I oversaw this program specifically when I first started working for AbleTech 13 years ago. And it is really amazing to think about individuals with a disability not having the access to banking dollars, loan dollars that other people might have. Whether it's because they have a limited income, because they're on disability, or they have poor credit because of their disability, there is definitely a void in individuals being able to have access to those dollars. So the Administration for Community Living and the AT Act program ensure that this is part of those AT Act program services to give individuals with disabilities access to those dollars. We do it in partnership with a couple of other agencies. One is a nonprofit called Oklahoma Assistive Technology Foundation. They're the ones that hold the dollars. And then we do it, our banking partner is Bank First of Stillwater, specifically the Stillwater branch. While it still covers all of Oklahoma, that particular branch helps us support this program. It's a fixed interest rate for the life of the loan, easy, flexible repayment terms. It can be used to cost share or copay from what maybe insurance or other providers are not covering. We do an occasional cost share with Department of Rehab Services, for example. And then we have some special qualifying terms for those applicants who have limited income or other credit concerns as a result of disability-related circumstance. These are some examples of some of the types of items that we have funded with the financial loan program in the past. Hearing aids are very common. Modified vehicles are a very common item. And some of those lower dollar home modifications are pretty frequently item loans that we are doing for individuals. We can do a loan with repayment terms up to 60 months. And really just kind of depending on the AT purchased of what those monthly payments look like and what the maximum amount of loan term is. It's very individualized, looking at the individual's income versus debt and what that income to debt ratio looks like. And we have a financial coach that works with our applicants to help them make that informed decision of what their capacity can be on what that repayment is. Again, feel free to interrupt me at any time if you have any questions. Those are some of those core programs that we do. We also have what we refer to, the AT Act program refers to as leadership programs, and that's training, information and assistance, technical assistance, and public awareness that we provide. And as you can imagine, all of those are just helping people become more informed, whether it's the individual or whether it's the agency on providing services for Oklahomans with disabilities. Sorry, my finger clicker keeps not working. I wanted to talk to you about this program as well. Digital accessibility is a growing focus on AbleTech on ensuring that agencies across the state, whether public or private or government, are offering accessible products through the digital world. So whether it's face-to-face virtual training, helping agencies assess their websites, assess their web applications and documents, troubleshooting, and helping come over those barriers, and accessibility policy and strategy guidance. Some of you may be aware that Title II changes just came out over the past 30 days or so in regards to digital accessibility being included in that Title II law. And so AbleTech has been putting together a plan to help Oklahoma agencies determine what those steps look like to ensure all of the content that is coming across the web or in written content is accessible for all individuals. I encourage you to go to okabletech.org if you want to learn more about those resources, or reach out to the email address that's on here. It's abt.a11y@okstate.edu. That A11Y has become the national lingo for accessibility ally. I know it's not definitely not my realm, but it's funny to hear our coworkers that are in part of that talk about that. So that kind of covers, golly, I've got to learn to start talking slower. That covers the core AbleTech programs and services that we provide. On here is my contact information. I will pause. I do have a couple of other updates that I'd be happy to give, but I will pause for a minute to see if there are any questions or comments or anything that I can answer from the audience.
Just looking at our attendance and the folks who registered for the call, we have many folks who cover many rural areas of the state. And so kind of doing that intake of patients, can that be done virtually or via Zoom, or do they need to travel to Oklahoma City or a regional location? Logistically, How does that work?
Great question. In fact, I am going to, for just a second, stop sharing and pull up AbleTech's website. Because absolutely we can work with individuals across the state a variety of different ways. Hold on. And a variety of different ways. And the first place that you could start is on the Able Tech website. Go in and request a consultation. That goes out to our AT experts. And then we will reach out and connect with you, whether it's in person, on the telephone, over Zoom, whatever that might be, and whatever those needs are. We can do a lot over the distance of the state by doing virtual demonstrations or making appointments to come to the office. We also have several partners across the state that help us do these demonstrations. And those partners are going to be focused on specific disability conditions, typically. For example, NewView. NewView focuses on low vision across the state and provides home evaluations and training. And they are one of our partners and can certainly access services that way. Department of Rehab Services. We have several outpatient clinics that partner with us across the state that help individuals get access to that assistive technology and decision making. That was a long-winded answer. You can go to our website and see all kinds of publications that we have and information that we have available. I would love it if each of you signed up to receive our monthly newsletter so you can get that information regularly. We have our online digital accessibility courses. Tomorrow at a conference, we are launching one new program, and it is assistive technology respite kits. I'm very excited about this. This is in partnership with Oklahoma Human Services, Aging and Protective Services, Community Living, Aging and Protective Services. But this is where we can do a little bit of an extended loan, particularly focusing on individuals that are providing care, right? So whether it's your child or your mom or your grandma or next door neighbor, and helping find some assistive technology that's going to help you do that job a little bit easier. So whether it's sensory items or safety items or those daily living types of assistive technology, helping find those solutions so that you can use it. The loan term for these are going to be for about 8 weeks, about 2 months, which typically, as we know in healthcare, usually after a couple of months, either conditions have improved, conditions have digressed, and you were looking for some different types of technology. I'm very excited about that project. I also wanted to share with you from our website. Hold on, I'm having to scoot everybody over. Under our resources is an assistive technology funding guide. And that is a great way to go and look for public and private funding, whether it's grants or state agencies, to find ways to fund assistive technology and kind of learn about the map of how to get through it. What are the requirements? What are some of the things to look for to help you qualify, to have all of your ducks in a row for that? And we have also broken down that funding guide according to AT categories too. So if you know you have someone that you are needing some vision support on, you can go and look for these funding opportunities that support that particular disability. That is about all I have, unless you have other questions.
I am not seeing any come in the chat, but this has been very, very helpful, and I appreciate your time today. If anyone gets off this call and you have any questions or want to get in touch with Shelly, please do not hesitate to reach out to me. Thank you again for your time today, Shelly.
Yeah, absolutely. Thanks for having me.
All right, everyone have a great day. Thank you.